What's up, guys? It's Dr. Tim Jackson with another episode of the Boss Body Podcast. Today, I have a very special guest, Dr. Cathleen Gerenger. Dr. Gerenger, she's a chiropractic physician, a functional medicine specialist who also works with epigenetics, regenerative medicine, hormone optimization, athletic performance enhancement, and a number of other conditions. She's also Miss Vietnamese Community of Florida Queen, correct? Did I get that right?
Yes.
All right. So we're in the presence of greatness. I asked her to wear her crown, but she misplaced it. It's in the shop or something. I don't know. But we'll see if she can bring it out at the end.
While I make every effort to broadcast correct information, I'm also still learning. I will double check all my facts, but realize that healthcare is a constantly changing science and art. One doctor or healthcare provider may have a different way of doing things from another. I welcome any comments, suggestions, or correction of errors. I take no money from supplement or device companies. By listening to this podcast or reading this blog, you agree not to use this podcast or blog as medical advice or to treat any medical condition in either yourself or others, including but not limited to patients that you are treating. Consult your healthcare provider for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the podcast or the website. Under no circumstances shall any guests or contributors to the podcast or blog or any employees, associates, or affiliates of the Boss Body podcast be responsible for damages arising from use of the podcast or the blog. This blog or podcast should not be used in any legal capacity whatsoever, including but not limited to establishing the standard of care in a legal sense or as a basis for expert witness testimony. No guarantee is given regarding the accuracy of any statements or opinions made on the podcast or the blog.
Dr. Geringer, so tell us a little bit about, obviously, you do adjustments, but you go way beyond that. So I know a lot of our listeners and followers, they ask me, well, I get adjusted once a week or, twice a month, but, 2 days later, I'm in the same position. Why is that?
Well, let's start out with the basic anatomy and physiology of the body. Of course, we know that when we are not at ease, when we're at dis-ease, that's a spinal misalignment, things starts to occur. Your body can show symptoms like pain, okay, low back pain. Patient comes in, they get an adjustment, they feel better, they go home. But we tend to forget that this is not 1895, where stress are a little bit different. They're not exposed to environmental toxins like we do. They're not exposed to hormonal imbalances. So there's so many multiple factors. So what you and I, Dr. Tim, what we agree upon is that the body needs to heal itself. However, you have to support the underlying problem. The underlying problem can be nutritional deficiency, hormonal imbalance, or even genetics.
Absolutely. And so inflammation, almost everyone today is inflamed, and chronic stress perpetuates that cycle. The more we're in a fight or flight state, the more inflamed we're going to be because the parasympathetic system helps the anti-inflammatory control. So stress, do you see people when they're hyper stressed, whether it's financial stress, physical stress, emotional stress, they need more adjustments?
Absolutely. So what we usually do that's a little bit different with my boutique type of practice is that I've been in practice for over 20 plus years. So I started out musculoskeletal because that's what I learned from chiropractic school. But as I went on, I was like, wait a minute, there's something else that's going on in there. And I was very fortunate enough that I had a very nice orthopedic doctor down the street, and he was very open-minded to alternative medicine. And this is 20 plus years ago, okay?
Mhm.
They usually don't like chiropractors because we're just like backcrackers or whatever they call it.
Right.
And he was so open-minded that he sends patients to see me to prep them up before surgery. So then his surgical outcome is a lot better. Why? Because he understands that not only do I want to align their spine, but I talk about how to nourish their body from the inside out. We know our disc is loaded with vitamins like vitamin C, water, all the good stuff to keep the tendons and ligaments nice and lax. So sometimes, I'm not against surgery, but sometimes if that particular patient has that tear in it, I'm sorry, but no matter what we do, it's not going to repair that tear. We have to rehab it. We have to be able to go in there and balance that so that they don't have to come back over and over and over again.
Yeah, it's funny, when I was in my doctorate program, I saw a local chiropractor who did active release technique, and he would adjust, but his primary focus was soft tissue work. And people would say, "Oh, well, why do you have to go?" I'm like, "Well, I don't have to go, but I lift weights 4 to 5 times a week. So obviously you're going to create adhesions and trigger points." I said, "It's interesting that you think it's an issue getting soft tissue work once a week or twice a month, but you're okay with popping pills every day for the rest of your life, and you don't see a problem with that." Alternatively, people will say, "Oh, well, adjustments are dangerous." I'm like, someone cutting you open and putting a foreign body in your facet joints, that's not dangerous. That's going to create a chronic immune response because they don't do the immunogenic testing to see if your immune system reacts to the material. Actually interviewing in a month and a half, an orthopedic surgeon in Oklahoma who now he does mostly regenerative medicine. He tries to keep people out of the OR because he had a fusion himself. Well, as you know, a few years later, 3 to 5 years later, the segments above and below are going to need to be fused because they become hypermobile to compensate. And, if you don't look at the entire kinetic chain, I mean, let's look at the example. If I'm kyphotic, well, if I go into shoulder flexion, my subacromion, it's going to impinge on my rotator cuff tendon. So if you do an x-ray of me in thoracic extension and then in flexion, then it's going to be misleading, right? And then, they'll gladly go in and do a $60,000 surgery to repair your rotator cuff tendon. But if you don't fix thoracic mobility, it's a Band-Aid at best.
Absolutely. And one of my niche is treating golfers and mainly the pro golfers. I started out with them on the PGA tour. So now my guys are on the senior tour or the champions tour, they call it. And it's funny that you mentioned about the rotator cuff tear. And with the rotator cuff, they have to understand that there's these muscles, ligaments, and stuff like that to keep our extremity attached to our body. So they go in there and they perform the surgery on the shoulder, but they forget about those muscles in the back. So you have to align that thoracic spine so then that shoulder blade can glide back and forth on their golf swing. So some golfers get it and some don't. But I take a step a little bit further where we have a medical facility where we have our nurse practitioner, MD, and we work together as a team. And what we usually do is that we recommend peptides. We recommend CJC 1295. We recommend BPC 157, which helps to repair and recovery. So these athletes can perform, at the optimum level so that they're able to prevent injuries or even future surgeries.
Absolutely. So I'm glad you brought that up because I know it's different for each sport, but peptides are, I mean, because the banned list for substances, like I know the NCAA, they banned milk thistle because they think if you're taking it, you're doing it to clear the liver of anabolic steroids, which is kind of ridiculous. But are you allowed to use peptides with
It really
PGA?
depends. Actually, it really depends on the tour. I also have baseball players that are professional baseball players that we see too. And with them, they're very strict. I had no idea how strict the baseball, the baseball, whatever association is. I was like, wow. So sometimes the peptides can be very tricky. However, the beginning of, I think it was this year or something like that, they banned all the really good peptides, let's put it that way. But there are ways that we can navigate through it because we're not using it to treat or cure anything. But
Right.
it's really that because it's been around for years, especially BPC 157, which is so great for gut health, celiac disease, autoimmune, anything that deals with the gut. And plus, it helps with recovery.
Yeah, absolutely. I mean, I know they started using it for orthopedic injuries, and people were saying, "Oh, well, my gut feels so much better. My brain fog is better. My workouts, I'm stronger in the gym." And I think it's interesting that, especially in like professional football, opiate prescriptions are very, very common, and it's common for people to get addicted. But, peptides are frowned upon, exosomes are frowned upon.
Yeah.
I have many colleagues that had to set up practice in Mexico because what you can do here is so limited and the claims you can make are so limited. But in terms of stem cells and exosomes, I know you said that's one thing you wish you would have known about 10 years ago. Do you have any good case studies off the top of your head where you've
Oh,
seen pretty awesome study or pretty awesome outcomes from the use of stem cells?
Oh, absolutely. I'm a big fan of stem cells because I use it myself. I just turned 50 this year and I feel absolutely amazing. What really got me into chiropractic was I was in a really bad car accident and I knew nothing about chiropractic. And at that time, I was at UF trying to get into pharmacy school, believe it or not, because I was going to be a pharmacist. And I was at the seminar sitting there and I could not even sit because my lower back would hurt so bad. And it was a chiropractor that was sitting next to me. And he's like, "Oh, are you having back pain?" And I was like, "Yes." And he goes, "Why don't you come to my office and let me take a look at it?" And in my mind, I'm like, he's going to snap my back in half, because I was tiny.
Yeah.
But I was desperate because what I did was that I went through the medical route. They gave me pain pills, which made me tired, drowsy. And then it gave me an ulcer. Then they gave me like Tagamet, and I think at that time Tagamet was for gastric ulcers, and it wasn't over the counter back then, so I had a prescription for that. Then they threw my cycle all apart, and then they want to throw me on birth control pills to control my cycle. And
Yeah.
then suddenly I couldn't concentrate because the pain pills were making me sleepy and I couldn't eat. And I mean, it was terrible. And the last thing that they did was that when I told them I couldn't focus in school, they're like, "Oh, you must have ADD. Let's put you on Ritalin," because Adderall didn't exist back then. And that was the straw that broke the camel's back. I was like, wait a minute. I don't have ADD, and I know that for sure. So I actually went to the chiropractor because I was desperate. And that's how patients actually find us most of the time, right?
Yeah.
They go from one doctor to the next and to try to find answers. And they finally found us and they're like, "Okay, what can you do for me?" So believe it or not, when I had my first adjustment, my headaches went away. I'm like, "OMG, what is this?" And then about 3 months into it, that particular chiropractor taught me about how to nourish my body from the inside out. So I was very fortunate and I was very blessed that I went to a chiropractor that understood and taught me that health and wellness isn't just a manipulation. It
Right.
is addressing the deficiency, getting rid of that inflammation so your body can heal itself. So I don't have to see him 3 times a week forever, ever, and ever. And I was
Right.
very blessed to be introduced to that type of philosophy in the very, very beginning.
Awesome. Well, yeah, that's a pretty amazing story. It sounds like you're getting great outcomes combining, chiropractic care with regenerative medicine, stem cells, exosomes, peptides, nutrition,
Acupuncture,
what's that?
acupuncture.
Acupuncture. Oh, yeah, that's right. Forgot. I remember reading now. So you are a certified acupuncturist as well. So I know with chiropractic, the focus is mostly on the nervous system. But talk to us a little bit about the primary difference people may not know between chiropractic and acupuncture, besides the adjustment part. Like,
Okay. So with acupuncture, we believe there's energy flow throughout the body. And these Chinese people, they know about that 5,000 years ago, before X-rays, MRI, CT scans, or any kind of blood work. And to me, that was amazing. And of course, I grew up with Chinese medicine, but I was raised here in the United States. So I always laugh at my parents when they're like, oh, eat this food because it's very yin, which is alkalizing. Eat this food because it's acidic, which is, yang. So I'm like, that's so old fashioned. But the more I went through school, the more I was like, wow, they kind of know what they're talking about, because
Right.
these kind of these kind of healing modalities was embedded in us from generation to generation to generation. So without any medical background, my mom can cook us foods that she would do food rotation. So we never eat the same thing over and over again, because then our body would adapt to it. And we talk about receptor cells. If you keep taking the same stuff over and over again, you can saturate those receptor cells. So sometimes food rotation, according to the season, helps. And what we do in our practice is that we rotate their supplementation winter, spring, summer, and fall. So they don't have to swallow 20 pills at a time. So we give each and every organ a little bit of a break. It's amazing how we can make the connection between nature and our body, and using modern medicine, just like blood work, MRIs, x-rays, and even genetic testing, to really figure out what is the best modality for that particular patient.
Absolutely. And so with golfers, one thing I would see, I mean, well, this is true for non-golfers as well, but lack of hip mobility, especially internal rotation and extension. And then get gluteal amnesia, your butt goes to sleep. And you start using the lumbar spine, you're getting motion from there instead of from the hips. Do you see that a lot with the golfers you work with?
Yes, I see that a lot. Musculoskeletal wise, of course, they come in with lower back pain, so they expect you to just focus on the lower back. I would tell my golfers, dude, you got that QL muscle, quadratus lumborum muscle, that attaches to your ribs all the way down to your
Mhm.
lower back and the top of your head. And by adjusting the spine, yes, it helps to release that subluxation. But I believe in working on the muscles and the tendons around it, and going down to their knee and going down to their foot. And the reason why is that, because I'm a golfer myself, that with the golf swing, it's a lot of moving parts in there, and a lot of pressure on the knee, on the ankle by the swing. And of course, then we work from the bottom all the way back up. But most of my golfers that I got really into the niche is when I start using acupuncture on them. And with acupuncture, I really kind of like calm the nervous system down. So when they're aligning themselves for that putt, they're able to completely focus without popping pills. Like back then, Lexapro was like the pill for them to take.
Right. Absolutely. Yeah. I went to undergrad at Wake Forest. And so golf was, a big sport. We were in the top 15, I think, all 4 years I was there.
Mhm.
Um, and, Arnold Palmer went there. So one of the dorms was named after him.
Oh, wow.
Um, but with, golfers, oh, I like it. I like it. That's awesome. With golfers, yeah, I think a lot of times they, look at, okay, I have knee pain. And that's true. I mean, I even had a patient one time who was referred from an orthopedic surgeon, and she had knee pain. And so obviously I'm, looking at her hip, looking at the whole kinetic chain. And she said, well, my orthopedic surgeon wanted to know why you're looking at the hip and I have knee pain. And I said, well, this is the femur and that's the femur. So if one end moves, the other end has to move. And it's just surprising, someone who went through all that school. I mean, I understand how they're trained, but it's just like literally a few inches down. So it's surprising, but more and more orthopedic surgeons and neurosurgeons are open to, manipulation. I mean, when I was in high school, I remember MDs didn't like DOs.
Mhm.
They had a beef with them. So, it's all this scope creep. But, the reality is patients, I mean, the highest we rank is like 11th or 12th in any health category. And the
Mhm.
lowest is 37th or 38th.
Oh, wow.
And, we spend more than any other country by far. The UK, I think, is next. And so people are seeking out solutions because they're being handed pamphlets and told there's nothing you can do. go home and die, which I mean is horrible bedside manner, plus it's unethical, and it leaves them with no hope. And then obviously that's another stressor, right? And I know you talked about in the form that you completed the importance of community social support. And if we look at the blue zones, for example, I'm not promoting that anyone smoke, but some of the people who live to be 100 or more, they're smokers and drinkers, but they have a strong sense of purpose and powerful social connections. So talk about the importance of social support and community involvement.
I'm big on community involvement because of course, my personality. I'm a pretty extrovert, and I always believe in going out there, and it creates what we call a sense of belonging. And what I find out is that, of course, after the pandemic, their social skills, and especially it affects a lot of the younger generation where they didn't understand what was happening. And it breaks my heart because I remember I was coming back from the gym, and one of the ladies that work at the gym, she's a teacher, and she told me that she teaches, I think it was like first grade or something, and there was this little shy boy in her class. And of course, during COVID, they all had to wear a mask to go back to school.
Mhm.
And she said that after that, because he was very shy to begin with, so the mask actually, how can I say it, kind of like shield him from the world. And I thought about it, I was like, wow, this poor kid, it's going to really affect him 5 years or 10 years from now. And so what I did was that I decided to throw this huge block party in my community and just get like family coming out with kids and stuff like that, and bring that normacy feeling back again. And we
Yeah.
talk a lot about mental health. We talk a lot about anxiety and social anxiety. So by being community queen, what I usually do on my spare time is go out in the community and just connect people and networking, and also driving families and friends to gather together so we won't be like hiding inside. And especially when people are working from home now, I had some people come to see me and they're like, wow, I've been in my jammies for like 5 days. And I'm like, you haven't walked outside into the world for 5 days? That's disturbing.
Absolutely. Yeah, I mean, we're not meant to go it alone. And now, like for example, the neighbors on this side, I don't know. I've seen them like once, maybe twice in 2.5 years. And we're so isolated, we don't talk to people. And I mean, here in South Carolina and the southeastern United States, I mean, you're walking down the street, everyone says hi to one another most of the time. But when I visited colleagues in the Northeast, you're walking down the street, you say hi to someone, they may call the cops. I mean, they look at you like, what's wrong with this person? And so I think the pandemic definitely brought that out and made that worse. And I think the social anxiety created by it was definitely worse because the internist I know, they said the two departments that were overloaded in the hospital were the psych department and the cardiology department because people were so stressed they were having heart attacks and strokes.
Exactly. And it's really sad. And I think that we see it across the board, even in the allopathic medicine, that there's a cry out there for help, that we all need to create this social connection. And again, being part of a group, or create like a hobby where you can meet up with people. And there's social
Mm.
meetups that you're able to gather together, and it's fun, like create a community, and so you're able to be out there and share your thoughts. And actually it's funny because I was talking to this therapist friend of mine, and we were talking about, oh, I have these monthly get-togethers with my girls, my Orlando group, my Tampa group. I'm all over the place, and everybody's got problems. And then when you sit around, you talk about certain problems or whatever, then you come home, you're like, hey, my problem's not that bad,
Right.
right? So I
Yeah.
think it's a good thing, in a sense that, hey, you know what? It's okay to not be
Yeah.
okay every now and then.
Right. I mean, especially in the age of social media, everyone's posting photos on yachts, videos, and sports cars. And for most people, that's not the reality. That's just a small percentage of their life, if it's any percentage at all. In terms of things that you're working on now that you're excited about, what are some projects that you're working on?
Oh my gosh, where do I begin? What did I write there? I feel like I have more add-ons every week. So my biggest rollout that I would love to sit down and spend time to do is to write a book. However, because of what we do, I do functional medicine. I'm in chiropractic. I talk about acupuncture, thyroid, mindset. I was like, and now queen and community and mental health. It's like, where do I start? So that's the part. So I'm working on that. And then I have like an online platform that I'm putting together where we can host like webinars and things because I love to teach. And I feel like the more reach, and that's the bonus part of about being on social media, is that you have this reach that you're able to help so many people. I was on this docu series that they came to my clinic and filmed me and stuff like that, and it was for a friend of mine, and he's a philanthropist, and then he launched a docu series, and this lady reached out to me. It was just like a couple weeks ago, and I got onto a call with her, and she goes, I watched your docu series, and she was having chronic pain, where her legs were like in pain all the time. She had to, she couldn't even get to work. She couldn't even walk to work, where she was able to not do anything. She was just at home, and she couldn't have the finances to go and get help. And we
Right.
hear those cases over and over again. She said what she did was she was watching, and I have no idea what I said on the docu series because I've been on so many podcasts and webinars and all
Right.
this stuff. And she said she watched one of the docu series, and I was on it. I think Genesis or something, or Decoding Cancer or something like that. So she
Huh.
followed the regimen, which is alkalizing, talking to the body's ability to heal itself, because her doctors couldn't do anything except steroid meds and pain pills. And she was so depressed because she's in pain all the time. So she actually healed herself. And that motivated her, where she was like, we were talking like this, and she was absolutely fine. And she runs a holistic center in South Africa. It's an amazing story. So who knows who we're able to help out there without
Right.
even knowing we're helping them. To me, it just fulfills the heart. And I'm so grateful that that I'm giving these healing powers with just healing those that are out there that needs to, or it gives them hope, right?
Absolutely. And I would say, you have to ignore the haters and the trolls, no matter how much good you're trying to do in the world. Someone is going to have something negative to say. And I think, a lot of people have a lot to give and a lot to offer. They're afraid of the criticism, but you're going to be criticized no matter what you do. So you may as well do what's right and what's true to your heart, what lights your soul on fire. So, I mean, don't let the trolls discourage you, because in the beginning I allowed that to happen, and I had to learn the hard way. People are going to complain no matter what. Um, in terms of regenerative medicine, you guys you need nutritional IVs as well in terms of adding that to the regenerative medicine piece.
Yes, I am a big fan of something called glutathione, and that's the mother of all antioxidant, and it's listed as a peptide. So what it does is that it goes in there and helps the body detoxify. So everything goes through our liver, even supplements, foods we eat, of course, medication we take, or even environmental toxins can invade the body. So everything has to go through that liver to process it. So what glutathione does is that it helps the body, because our body makes it, but unfortunately, as we start to age, our body does not make that glutathione. Well, it does, but not to the maximum amount. So by taking it through an IV, or even do sub-Q, which is subcutaneous injection by the little insulin needle, what it does is it helps the body detoxify. But glutathione actually is known as the celebrity's beauty secret. What they use is to smooth their skin and hair. So it's really great for the skin and hair because again, to treat those kind of problems isn't just a cream or a lotion or a potion. You have to treat it from the inside out.
Right. Absolutely. Glutathione, when I first got a glutathione push back in 2006, I mean, I've never done illicit drugs, but I thought, wow, this must be what heroin feels like because I was so deficient. I just sat and stared at the wall for about a half an hour.
Mhm.
And I'm not taking it right now, but I do glutathione cream sometimes. I'll do
Mhm.
S-acetyl L-glutathione.
Yeah.
I get the pushes when I can. It's great stuff. Along with superoxide dismutase. Carbon 60, I haven't taken in a while, but that upregulates glutathione, superoxide dismutase, and catalase.
Uh-huh.
And studies in rats show a 25% increase in lifespan with the C60. So I think Purple Power is supposed to be a good brand. A lot of colleagues use. I don't know if you have
Yeah.
any experience with that.
Actually, another B3, but niacin is a great pathway for glutathione and things like that, or even NAD. So they're finding out that the niacin, higher amounts of niacin, really helps that. And of course, with niacin, we usually use it to vasodilate, so it helps to decrease the blood pressure, and also it really helps the cognitive function too. So I'm a big fan of niacin.
Yeah, I love NAD and the precursors. I would just caution people, it can deplete B12 and B9, so the
Mhm.
methyl groups. So if you're having trouble methylating with MTHFR and the other genetic variants that go along with that, make sure you're supplementing with those if you're going to do niacin or NAD plus. I take a low dose niacin twice a day. I was doing higher dose around 1,000 milligrams 2 to 3 times a day, and my hemoglobin A1C went way up. So it can, you have to be careful with the higher doses. But yeah, NAD, I've done the IVs. When I worked at a physical clinic, we had a surgeon who was addicted to, I think it was Oxycontin and crystal meth,
Oh,
and he
wow.
did 2 rounds. So, one round is 10 days straight. So a total of 20 IVs. Within 4 to 5 weeks, he was back operating.
Isn't that amazing? And
Absolutely.
that's the way, and I just wish that all addiction centers would implement more of the IV pushes and stuff like that to nourish the cells. The reason why people are addicted to certain stuff is because there's some kind of imbalance going on,
Right.
neurologic. And of course, we talk about the gut microbiome, but if you restore those imbalances, the body has a chance to again heal itself.
Yeah, absolutely. I mean, if you look at smokers, typically they're low in norepinephrine. So
Mhm.
if you look at Wellbutrin, it is a selective norepinephrine reuptake inhibitor, and that's how it decreases cravings. But you can just take N-acetyl L-tyrosine or plain L-tyrosine, same thing, and balance your neurotransmitters, decrease toxins that are getting into the brain, especially mycotoxins that decrease blood flow to the frontal lobe. And being where we're both in the southeast, mycotoxins are everywhere. 50% of all buildings have overgrowth of mycotoxins, and it can cause weight gain, rapid weight gain. I've seen it in fitness competitors, figure competitors. And do you test for mycotoxins in your practice?
We do a lot of, I usually start out with basic blood work because it's like everybody understands that. And so actually 25% of my patient base are either oncologists, internal medicine doctors, or other healthcare providers, such as like nurses and stuff like that. So I do a basic comprehensive blood chemistry. So from there, let's say I test their hormones, I test their thyroid, T3, TSH free T3, free T4, TPOs, reverse T3, the whole 9 yards. Then we'll figure out an action plan for them and see what's going on, and depending on their age group. And if they're of a younger generation, I don't just go in there and, give them hormones. What we do is that we balance their gut. However, what we find through clinical practice is that once when they get to that menopausal, andropause state, it's very hard to start with their gut. So we start with their hormones and really help them with the mental clarity. And then we go backwards. Then we repair their gut. Because I can tell them, hey, you need to take this, you need to eat that, you need to do exercise. They are so overwhelmed and they're in this big mental fog. There's no way that they can even put another thing on their to-do list. So
Right.
what we do is that we go in there, and then you guys are so easy. We flip that testosterone switch on. Everything is perfect. With women, oh my gosh, testosterone, progesterone, estrogen, thyroid, the whole 9 yards. So it's like little pieces of puzzles, but I absolutely love it. And then we do either we do the stool sample, or we can do hair intolerance testing, because before we only do it with blood. But now everybody's always in a rush. Everybody's always instant coffee, instant tea. They're like running all over the place. So I just take a couple samples of the hair, because there's so much information in your hair. We can send it off, and we're able to look at it and analyze to see intolerances, food intolerance, also environmental toxins, and deficiencies as well that we're able to analyze. So there's so many stuff out there, but instead of overwhelming them, I just kind of go step by step.
Yeah, I mean, we can create, an action plan with 30 different things, but they're going to feel defeated and overwhelmed. And so, if you can help them experience small wins in the beginning, then they say, hey, this stuff actually works. They know what they're talking about. Now let me follow through and see what's next.
And that's really important, because if you put yourself in the patient's situation, I always believe the less is more. The less therapy, the less supplement, the less things I have to give my patient, the more I want them to be able to heal themselves more naturally. And of course, we do need to supplement. I'm sorry. It's just that the food out there is not where it's supposed to be. The stress is high alert. Everybody's everywhere. Like, I take supplements. I have to practice what I preach. How can I still go out and function and practice and do what I do if my hormones is not optimized, and if I'm not getting the quality of sleep that I need? And talking about sleep, it's sleep, energy, and sex drive. Those three is so important for us to live that wholesome life.
Yeah, absolutely. I tell people at the end of the day, I want to know your body temperature. That's going to tell me your metabolic rate, independent of what your labs say, and your libido, because nature only wants to create stronger, smarter human beings. And so, what's the number one growing field in allopathic medicine? Reproductive medicine, right? And so, environmental toxins affect fertility, celiac and gluten sensitivity, glyphosate can affect it. Um, Pesticides, atrazine, endocrine disruptors. So all of those things. And I actually created a program about 10 years ago for Learn It Live. It's called Prepare for Pregnancy. It's about, a year-long plan where, we open your drainage pathways, work on optimizing your gut. So, if mom has too many lipopolysaccharides from the gram-negative bacteria in her gut, that will deplete glutathione in the baby's brain, predisposing them to neurodevelopmental disorders. And
Exactly.
so, they at first they were like, well, what does my gut have to do with my pregnancy? I'm like, it has a lot to do with everything.
Absolutely. And they have research that shows that if you take an autistic kid and you check their vitamin D levels, it's going to probably be low and deficient. And then if you check the glutathione levels, it's very low. So it's important. And I always tell my patients that, with epigenetics, with breakthrough medicine, we're able to have that blueprint. That blueprint will allow us to see what we're able to shut off or turn on. So of course, our genetics, we cannot change it, but our epigenetics, we're able to turn on or off those genetic expression. So if somebody that has a family history of diabetes or blood pressure problems or weight problems, then those people have to work a little bit harder. For example, I'm Asian, so my girlfriends, they can eat anything over under the sun and they won't gain weight. For me, you sneeze on me and I'll gain weight. So I have to work extra hard. I have to make sure I go to the gym. I have to watch what I eat, and I have to live a healthy lifestyle. It's not fair, but I know my genetic predisposition said that I'm more likely to lose weight and gain that weight back. So I have to adapt that lifestyle. But it's so fun. Now we're able to isolate those snap genes. I
Right.
remember during my UF in my undergrad eons ago, I was sitting in this auditorium and they were just talking about the snap genes. I remember vividly sitting in that auditorium, and here it is. I'm able to test for it. It's
Yeah,
amazing. Yeah.
absolutely. So I started incorporating epigenetics around 2011. Back then it
Mhm.
was 23andMe. And
Yes.
we were just looking at SNPs. Now I use the DNA company, and we look at copy number variants. We look at insertions, deletions, loci. So the SNPs are important, but there's many other, insertions and deletions are like looking at chapter or paragraphs missing from a chapter in a book. So those are super important.
The
Um,
comp genes. I was reading that DNA company about the comp genes. I was like, wow, this is amazing because it's like you have certain people. I don't know. For me, it's hard for me to get angry or upset. It sounds kind of weird because I was like, okay, let it go, move on, so I don't dwell on things. Some people, they love to dwell on things and they're able to like bring the past that happened like 10 years ago when it was like as if it was like an hour ago. You know what I mean, right?
right.
So there's a lot of people out there. So it's like comp genes that we're able to detect. So those are the people that kind of like hang on to stuff and would not let it go. I'm like, wow, we're able to
Yeah.
test that. That's
And
amazing.
there's a trade-off. I mean, the
Uh-huh.
comp genes, I have one of the variants
Yeah.
where you tend to have a higher IQ, but the
Uh-huh.
trade-off is you also tend to get stressed out more easily.
Yes.
And so you don't clear, the catecholamines. So they stay in your bloodstream and in your central nervous system longer. So, if I get ticked off, I'll probably be ticked off for the rest of the day, until those catecholamines clear. But looking at those, I mean, because that COMT also affects the clearance of estrogen.
Yeah.
So, if you speed it up to clear estrogen, you're also going to clear dopamine too quickly. And then, if low dopamine, you're more likely to have addictions, whether it's to food, illicit drugs, et cetera. So it's all about, whether it's too fast or too slow or right in the middle.
Mhm. Yes, it's amazing. And then and there was just a few weeks ago, I went to a friend of mine. She's got this neural biofeedback that we were testing the brain and me and the brain. I love it. And she was laughing so hard because one of the tests showed that it was something that showed up about me. And she goes, well, instead of thinking that, oh, okay, I process things really fast, so instead of saying, "Oh, let's slow down her brain waves being fast," we just kind of like laugh at it. And she's like, "No, we're not going to suppress that." And that's one thing about functional medicine or functional health is that we don't want to make everybody the same. We want to say, okay, what can we do to make you better? What can we do to kind of like decelerate that aging process as much as possible? And of course, now we have like testing that we're able to go and test, which I did myself too, that we're able to say, okay, this is your biological age and this is your chronological age. So if
Right.
we're born, like for me, I'm like 50 years old. That's like the age I cannot change. However, everything we've been doing, now we can test and say, hey, I've been doing everything pretty good. So then I'm
Yeah.
like actually aging 10 years younger than what my chronological age is. So
Yeah.
reverse aging, is out there. It's possible.
Yeah, I remember reading a study several years ago where they looked at a group of people who were all, they self-reported roughly the same level of stress, but one group supplemented with vitamin D and they exercise. I think they had them walk on a treadmill for 45 minutes, 4 to 5 times a week. Their telomeres didn't really shorten, but the
Mhm.
group that did not supplement and did not exercise, their telomeres did shorten from the stressors.
Exactly.
So, again, it's about modifying, it's not genetic determinism where you have this gene, there's nothing you can do about it. And, traditional genetics or geneticists, they don't even believe in epigenetics because they don't think that you need any supplements. But I don't know where they're getting their food from. I'd love to know because the soil's depleted of minerals and nutrients, and I eat organic 98 to 99% of the time. So there's really no way around supplementing the basics like a multi-mineral, especially extra magnesium and zinc, digestive enzymes, omega-3 fatty acids. Some people will say, oh, we'll just eat fish. But again, epigenetics, APOE, if you have 3/4 or 4/4, you can't detox mercury very well. And so that could be a recipe for disaster, especially if you're eating the bottom dweller, the large fish that eat the smaller fish. So again, it's all about context, I think. And that's why people say, we haven't, figured diet out yet. And, for me, if I go above 90 to 100 grams of carbs per day, I feel terrible. But if I stay, below that, I feel great. Some people, do very well on more carbs. I do well on more protein and healthy fats.
Exactly. Exactly. I'm more on the other side of the spectrum, but everybody's different. But I always say that it's not that one magic pill. It's not what that one magic diet. I just feel like eat in moderation. I say adapt to the Asian Mediterranean diet, And the reason why I say throw the Asian in there because rice is gluten free. So so staying in that kind of regimen allow our Hashimoto patients to be able to still have a life without feeling so restricted. It's like, oh, I can't eat this. Oh, I can't eat that. And that's one of the reasons why when a patient comes in and I don't throw them that intolerance testing immediately because I know it's going to come back and they're intolerant to everything under the sun. And when they look at the results, they go in hiding. They're like, oh my gosh, and they feel
Yeah.
like they're beat up again. So I always
Hmm.
believe, let's do one step at a time, allow you to feel a little bit better. Then you graduate from this part and let's
Right.
implement something else. And again, it's just like step by step. And that's the fun part of practicing. I love it.
Yeah, and I used to do the food intolerance testing as well, and people would come back lit up like a Christmas tree, so to speak. And then they're like, "Oh, what am I going to eat? I have, 4 to 7 foods I can eat." But if
Yeah,
you make the microbiome more diverse, then you can tolerate more foods. You balance digestive sequencing with stomach acid and digestive enzymes and bile. Your tolerances start to decrease and decrease,
exactly.
and so you don't feel as restricted.
Yes, and it's funny because what I find out through these years and through all these testings is that the food that we love the most is the food that we're intolerant to. And the reason why is that we kept eating it over and over and over again. So most Western people, they walk into the grocery store, they think broccoli is the only vegetable out there, and avocado is like king. And so they have avocado in their salad, they have avocado for dinner, they eat avocado in their smoothie, and then the intolerance comes back and avocado is like wearing red, and they wonder why. So going back to my mom and my dad and my grandparents with no medical background understood food rotation is important. That's why we have seasonal fruits and vegetables, winter, spring, summer, and fall. Eat according to the season. Keep it simple. So that allows you to rotate your food.
Absolutely. Yeah, I remember learning that back in the day. Let's say I eat a food today. Ultimately, it takes my body about 4 days to completely process and excrete that
Mhm.
food. And so, make Monday your chicken day if you eat meat, Tuesday your beef day, and so just by doing that, and I'm the worst at it, I have to work really hard because I find something I like, I want to eat it over and over and over and
Yeah,
over.
because it's convenient.
Right.
And that's why it's convenient. And I'm guilty of it because what it's mango season. I love mangoes. I'll eat fresh mangoes. I eat dry mangoes. And guess what? Intolerance test, mango shows up. I was like, darn it. So then
Yeah.
it gives me a check and balance system. I was like, okay, girl, back off on it. Yeah.
Right. Yeah,
Because
and it's so hard to find healthy foods that meet all the criteria. I'm looking for, higher protein, lower carb, some healthy fats, non-GMO. Okay, so right there, I just eliminated like 60 to 70% of foods out there.
Yeah.
So then, once I find 3 or 4 things, I'm like, oh, I'm going to eat this and this and this, and that's all. But, like you said, it creates an immunogenic response, which, low level inflammation over the time, that can cause joint issues, may manifest as bilateral knee pain or unilateral knee pain or neck pain. You can't have pain without having inflammation, right?
No, and that's why blood work wise, I usually check their inflammatory markers like C-reactive protein. I think the range is like 0.2 to like 5 or something like that. I like it to be under 1. I check for the homocysteine level, cardiovascular inflammatory markers, so we can actually bring it down. And if they have like all these autoimmune signs and symptoms, and medically we're so stuck on a diagnosis, is it
Yeah.
rheumatoid arthritis, is it lupus, is it, whatever, osteoarthritis, what is it, Hashimoto's. That's like, whatever it is, it's some kind of itis, which is an inflammation. So
Right.
let's just get rid of the inflammation, and then maybe the diagnosis will go away, it's as
Yeah.
simple as that. I mean, you and I see that. I mean, it's so
Yeah.
simple, but we love to complicate everything, right?
Yeah, and we put a label. A lot of people think if
Uh-huh.
we put a label on something that we understand it, because
Yep.
then that means there's an ICD-10 code, and then they can build insurance. Like for years, I mean decades, they said chronic fatigue immune deficiency syndrome was a psychosomatic disorder. Well, no,
Mhm.
it's a neuroendocrine immune disorder. Oh, but suddenly now there's a code you can build insurance. Oh, now it's real.
Yeah.
And I remember back, I think it was 2008 when Lavazza prescription fish oil came out. Fish oil
Mhm.
doesn't work. Fish oil doesn't work. Oh, we have one where we bill your insurance for $250, when you can get one for 45 over the counter. Oh, now it works, but only ours works. Ours is the only one in the world that works.
Or even vitamin D. They recommend high doses of vitamin D. And I was like, if they have a fatty liver, if their AST and ALT, alkaline phosphatates are high, why would you want them to have such a high amount of vitamin D all at once because they just have to take it like once a week? I'm like,
Yeah.
why can't you microdose it? I mean, it
Yeah.
makes sense.
Especially, I mean, one of the genetic variants I look at is called the vitamin D binding protein, or GC genetic variant. And if you have it, you need to microdose throughout the day instead of taking, let's say you're taking 5,000 IUs in the morning. Well, it's best to split it up 1,000, 2,000, and 2,000, because that
Mhm.
transport protein can then, get saturated and move it throughout the body where it needs to go.
Exactly. Or even couple it with, now they have it like ADK, because
Right.
the K2 is able to shunt the D where it needs to be at. And with the
Right.
A, it helps with our upper respiratory tract, not only for our skin, but our upper respiratory tract. And the K2 is great for our microbiome. That's where all the conversion occurs. So it's
Yeah.
I love it. It's like chemistry all over again.
Yeah, K2 is great. I've seen a colleague back in like 2007, 2008 showed me an x-ray of a lady, at baseline. And then a little over a year later, she'd been taking, I think, 320 micrograms a day of vitamin K2. And I mean, it looked like a different person. I mean, her femur, the bone density was just like doubled basically.
Absolutely. And going back to hormones and stuff like that, a lot of women that are going through perimenopausal and menopausal, I want to make sure that their address and really support their testosterone level, because testosterone is needed for us to not only to maintain muscle mass, but for the cognitive function and bone density, along with progesterone, which is a more common hormone. So anybody out there that's having difficulty in sleeping and things like that, I would say make sure you not only check other areas and not just popping like magnesium or melatonin or 5-HTP. They come in, they're like, yeah, I'm taking all this stuff at night. I was like, I mean, I love supplements, but it's like, there's something else going on in there. And then we put them on progesterone, they sleep like a baby, you know?
Yeah.
And so
It
I think,
activates those GABA receptors. I tell women it's like your natural Vicodin.
and
So
then
if you're snapping at people, you
Mhm.
might need some progesterone.
Exactly, and it's very breast protective too. So it's
Yeah,
important. And what bothers me lately is that my demographics before in this holistic medicine, functional medicine, and you probably see that too in your practice, is that our age group that usually come in is between like 50 and up. And then now I'm seeing these girls that are in their 20s that have hormonal imbalances now. In my
yeah,
practice, I'm seeing PCOS, polycystic ovarian syndrome, and they become insulin resistant, and they're weight gain. They have all these problems. I was like, wow, this is disturbing that it's affecting our younger generation. And then the
yeah,
fertility, is really high now, 30% now.
yeah. I'm sorry, what rate is 30%?
Infertility.
Oh yeah, absolutely. And the average newborn, I mean, this is like 10-year-old data, but the umbilical cord of newborn babies has between 250 to 300 known carcinogens.
Mhm.
So, we're being born toxic. And then I still hear people in the allopathic community say, you don't need to detoxify. You have a liver and kidneys. I'm like, I have a gas tank in my car too, but if I start driving from here to say Tampa, well, I'm going to have to stop and get gas. So like there's a statute of limitations, like you have to support the system. And it was designed to work well, but it can become overburdened. Like if I gave you 20 extra patients a day, well, that's a little absurd, right? You're going to become overburdened. It's the same with our liver and kidneys and lymphatic system.
Mhm. Absolutely. Like, yeah, I mean, our car still needs a tune up every now and then, or the Tesla needs a little, updating, or our iPhone. So does
Right.
our, and that's why I get like stem cell at least like once or every 2 years, because
Awesome.
it allows my body to replenish itself.
Absolutely. And so what's something today that you wish you would have known 10 to 12 years ago, or two things?
I think we talked about like stem cells and like epigenetics. And
Yeah.
and the reason why I say epigenetics is because I did my own genetic testing. I come from a very big family, and my mom had me when she was like about like 45 years old. So
Mhm.
already it got like zapped with my genes, because again, we women are born with certain amount of eggs in our body, and as we age, our eggs get oxidized. And now more and more women are not having babies in their 20s. They're waiting into their 30s or even 40s to have their first child. So that predisposed environmental toxins and all that good stuff. But I wish I know a lot more about epigenetics back then, because on my own guinea pig, I would have just like test myself and see how my body progressed, throughout the years, and just track data.
Well, that's awesome. Keep up the great work. I mean, you look 25, 30, no more than
Thank you.
33. So I need to get on the Dr. Kathleen program. Might be giving you a call at some point. But you also, I mean, I have another colleague who's a naturopathic doctor, and she's Vietnamese as well. And I said, I'm going to beat you in this epigenetic clock thing. She said, Dr. Tim, not happening, never happening. I said, how can you be so confident? She said, I'm Asian.
Exactly. We don't raise it. That's what we
I
say.
know. It's unfair. It's an unfair advantage, young lady.
Uh-huh. But it's okay, because we still have a lot to learn, and I love it. And thank you so much for even having this podcast, because look at how many people you're able to reach and inspire. And I just love it, educate, and that's what it's all about. Because being a doctor means to teach. So that's our job.
Absolutely. Wait, I thought it was just 10-minute office visits and handing out prescriptions. I'm so confused right now. No,
I
I'm just
know,
kidding.
right?
Well, thank you so much for your time, and hopefully we can have you back on in the future for some updates, and you might look like you're in high school then.
Oh, thank you. Aging
Well,
backwards.
exactly. I hope you have a blessed day, Dr. Kathleen.
You too. Thank you so much for having me on.
All right. Take care.
Bye bye.